listening to Tapped In, Buncombe County's half hour to empower on WRES 100.7 FM in Asheville. Listen up and get tapped into local important resources, information, and topics. Learn more about the topics of today's show at buncombecounty.org. Okay, it's time to get tapped in.
Well, hello, and everyone who is hearing my voice. It is Tapped In, and it is me, Zakia Bell Rogers, one of your hosts, and my co-host.
And I'm Leonard Jones.
And Leonard and I come to you from the Communications and Public Engagement Department of Buncombe County, where we also wear capes.
So today we would like to introduce our special guest, Will Baxter, Buncombe County's Community Safety and Violence Prevention Coordinator, which is housed in our Justice Service Department here at Buncombe County, who will discuss with us today the county's community-based public health response to violence. So welcome, Will.
And thank you for having me.
Yes, so Will, who are you? Tell our listeners who we're talking to.
I'm Will Baxter. I am originally from Rock Hill, South Carolina. I am a 14-year Navy veteran. A law enforcement officer of 9.5 years. I also worked with Health and Human Services for about 3.5 years, and I am new to the role as the Community Safety and Violence Prevention Coordinator for Buncombe County.
Wow, awesome. That is a pretty hefty resume. Like you've been everywhere, just serving. You see that, just serving the community all your life. I like that. And now you're in this role. So tell us about this role.
So the Community Safety and Violence Prevention Coordinator role is really, I'm a coordinator between the county around the grants that were just received, amounting, 2 different grants amounting in about $2.5 million. That were placed directly in the hands of community-based organizations to make a difference in the community.
And you said you've been here how long?
I started this role January the 30th of this year.
And what are your thoughts on it? How are you feeling?
The department really cares about the people in the county. And it seems like that their care for the community drives everyone to do the work that we do on a daily basis. So it has been a beautiful thing. I'm still learning everyone, but it is wonderful people to work with, from our director, Tiffany, Hanacho, all the way down. And it's just been a pleasure to go to work and just see their passion and their motivation for community on a daily basis.
Yeah, and so you're talking about the motivation to work with the community. So this next question leads right into that. Are there a particular community or areas that are a priority at this moment?
We have a few communities that we're looking to implement in first. It's actually 3 communities. One would be Hillcrest, one would be Klondike, and the D Review areas. And that is just because of the data that we received for the things that were, the violence that were going on in those communities.
Yeah.
And so my next question would be, so you said you have a program. So what is the purpose of the community-based public response to violence?
Okay, so thankfully the CDC listed community violence pretty much like COVID, a pandemic, is something that needs to be addressed now. So having a community-led response to it makes a lot of sense, because we're going in and working with the people within communities to tell us what they need in order for us to get them resources and to be able to help change the cultures in the neighborhoods that we're serving.
And so I just had a follow-up question around, just when you say community violence, what violence are we talking about? Are we talking about gun violence, domestic violence, or?
Well, to be honest, all violence is tied together. So it's really getting to the root causes of all violence in order to stop the gun violence and the killings.
And so, there are so many, ways that violence appears. And I think sometimes we look at the physical violence and don't understand like the emotional toll that the violence is taking on the community as well. So in this new program that you're having, and it's called a community-based
Public response to violence.
public response to violence.
Mhm.
How are you all also activating your services to help those folks?
Okay, so right now we're going through a very extensive training to become certified to do multiple things within the community, to be able to help those that are recovering from traumas because of multiple forms of violence, to be able to connect them with resources. So it's multiple ways that we are being trained in a proven model that has been operated and able to see the changes that have happened in those communities where this model has been implemented.
And so when you mention the model, what model is we're using to try to address violence in our neighborhood?
Okay, so the acronym of it is CHASM, but we use CPrV, which is the Community Based Response to Violence. CHASM is the community healing through activism and strategic mobilization. They're out of the Cape Fear region out near Wilmington. Brother Abdullah, we just actually finished up the first 2 in-person days of training. And just stepping into the room, everyone was kind of optimistic of, I've been through a lot of training. What is this going to teach me different? But we all left with a different respect of everything that we've learned over the last 2 days. Because it honestly, it helped us to understand in the Black community, a lot of things are different. So you have to reach it with a different approach. It can't be business as usual because African American communities are hurting in multiple ways. And we have to be able to address those needs and get them the resources that they need. And I think the training that we still got a long way to go to finish it, but I think with everyone that's at the table and even more that will be trained in the future, we'll have that understanding of what is needed in community to see a huge difference.
Now, listening to you, you said you've been through a lot of trainings. And I know as a community member, as a former social worker and a member of the community, multiple times we go to meetings, we go to trainings, we do all of these things, we talk and we talk and talk. But this is the action that came with the talks. And so I know as a community member, this makes me feel excited that we have this. How are we getting this information out to our actual community?
Well, like I said, we do deal with a lot of community-based organizations that are getting this. And as we scale up to do implementation, what you will see is a coordinated effort between the county as well as multiple community-based organizations that are going to be in community on a regular basis, providing resources, doing events in these neighborhoods, because we want to see the violence stop.
And so with the training, I know you mentioned there's some community-based organizations. Can you share who some of them were, or is it just community members who are present and active in their community? Just who are some of the people you're training? So what we're training them for?
So I can tell you that we had representation from My Daddy Taught Me That, the Spark Foundation, YTL, Youth Transform for Life, were present at the training. It was representation from Umoja as well as the Asheville Dream Center. Yeah, so it's, community-based organizations that are already in community doing great works. We're all present at this training.
Yeah. And they're being trained to be community health workers. So what is a community health worker, and what does that look like?
Okay, so a community health worker gets a very specific training. A lot of community health workers that you will see deal with patient advocacy. The great thing about the community health workers in this model is they're violence professionals.
Mm-hmm.
So they're being trained how to prevent violence before it happens, as well as dealing with people that are going through the trauma of the gun violence and the different kinds of violence within communities.
Mm-hmm. But you said something, community health workers are usually dealing with a patient.
Mm-hmm.
And if you think about it, they kind of are. They're the client, the patient,
Mm-hmm.
the service receiver. And you think about health, when we say trauma, most of the time or gun violence, or we only think about the person who was killed, or the person who did the killing, and we don't understand that it explodes like a balloon filled with water, and it just doesn't hit in just that area, it floods out. So not only does it affect the parents of both parties, the siblings of both parties, the friends of both parties, if both parties had children, and then it just keeps trickling down all the way back into the community itself, where other violence comes, other mental health issues come, because we're not very apt to go in and have therapy. Because a lot of folks, and we're talking about the Black community, so a lot of times we've been told that's not what we do. We don't talk about what goes on we don't talk about feelings. We don't talk about what's going on in our community. But I think one thing we need to understand as a Black community is that we don't talk about them because it wasn't eligible. It wasn't something that was freely accessible for us throughout these years. But now we have therapists who look like us, and we have workers who are coming out of this program that you're doing that look like us, going in and talking and helping and maneuvering around the systems to help our communities. So, you want to add anything to that?
And the biggest thing is I think, and I can speak from the lens of someone who's lost a family member to gun violence. It's different when it affects your family directly. So I hope we can get away from the looking at it as the lens of, okay, well, I knew him, but it doesn't affect me in that way, because it does affect all of us. Whether you want to look at it or not, you have to look at the simple fact that once gun violence happens in your area, you no longer feel safe. In a lot of instances, people may even feel the need that they need to carry a weapon which before they wouldn't have. So it affects us in multiple ways. And I think that we just need to understand that, in community, we have to get back to being, and you hear hood all the time. We need to get back to being neighbors and valuing each other and loving each other and put the neighbor back in hoods, and it needs to be neighborhoods. We need to come together and look out for one another and care about what goes on in the community, because when you value each other's life, it does affect you in the way that you described.
Yeah, it's very true. I mean, I'll be very transparent here that I'm a native of the area, and I have lost family members on both sides to gun violence, most recently here in Asheville, and that's on my mother's side and my father's side. So when the idea of who's been impacted is far-reaching, even beyond the neighborhood, because you may not live in a neighborhood where the violence is happening, but you don't know who it does impact, and it may be your coworker that you may assume they're nowhere near any of that riffraff or anything like that, but you just never know, especially just being from that area. So I truly understand what you mean, the impact that it has on people and how we move forward, because we do just, you miss your loved ones and you want them to be here, and so when you think of those gun violence, so just those resources. I know you had mentioned within this program, the connecting people to resources. What type of resources are we talking about for people to be connected to?
So as a community health worker, what my understanding is I won't be able to help every single person, but I know people, I have resources. So the biggest thing is understanding what the person is needing and getting them connected in ways that otherwise they would not have been connected to. So those are the kind of resources that will be provided within community. It's just understanding that they have basic needs that need to be met. And for whatever reason that they're not being met, we need to make sure that we're getting them the resources that they need, because people have at least the right to basic needs.
Yeah. And I think, people don't understand that, like, if your basic needs aren't being met and those things are lacking, your response to violence and things of that nature may seem even more outrageous to someone who's just looking. Because when your basic needs are met, you're able to, address those things as they come. But when you have chaos and you throw chaos on it, it doesn't like cancel each other out like negative equal positive. It just brings more chaos and it just keeps exploding. And so I think that's so important to help people understand that if we're not addressing those basic things, and we're talking about like food, shelter, clothing, those simple basic, the right to have a family and live with your parents and things of that nature, just those simple basic rights. And then you turn around and you're sleeping in a place and you're hungry and you hear gun violence. You're always gonna put those things together. Like if you're hungry again, is there something bad that's gonna occur? So the trauma starts to create other trauma stories and branches and things of that nature. Yes, no.
Absolutely.
He just smiled at me. Most folks will go, yeah. Yeah. He just smiled.
Absolutely.
And we know recently, I know we was talking off the radio earlier, and we were just mentioning with the violence, we often realize a lot of this is impacting our youth. So what's the role will youth play in this initiative and program?
So there will be youth-led solutions. So within the community-based organizations, a lot of them already are doing so much with the youth. And it's just about empowering the youth to understand that our youth have a voice that we need to listen to. That the day and age that we just push the youth to the side and say, grown folks are talking, be quiet and let us talk. We need to listen to the youth because a lot of the things that are going on within the communities, really within nationally, are affecting young people. And we need to be able to listen to them in order to make some changes. And those changes were needed like yesterday.
And as a professional, as a parent, as a community person, that has always been so strange to me that I don't know what age we turn where we forget where the connection of youth and adult. And we become the people that we didn't like growing up, that didn't listen to us, that didn't that made decisions about us. And and that's one thing I've always wanted. I tell Leonard all the time, that's one thing I want to change is how we see the youth. No, they may not know a whole bunch, but they know a lot, and so, give them a chance. They know their life. They're living it. You can say, oh, I've been there, done that. Have you been there, done that with the systems that they have right now? They have social media. We had a camcorder. My cell phone didn't have a camera on it when I was at their age. Okay, so it's like, a lot of things have changed. So just like we learned throughout COVID, there were so many ways to communicate. There are so many ways to include them in building a better future, not only just for them, but those who come after them. And that is always the goal. It's always to plant the seed so that not only you benefit, but those who come after still reap what has been sowed from previous generations. And we're not doing that. We're going in and we're taking the baton of, I'm an adult now. We're not taking the baton, breaking it, and giving it to the youth, and you both walk to the finish line. And so I think that's so important to point out, and I think it's so important that I think it's so great that you all are including the youth, because it's so important.
Absolutely.
So speaking of the youth, so how can the community get involved? Like what opportunities are there for people?
So there are a lot of community-based organizations, I did name a few of them, that are always looking for people to collaborate with within community. There will be a multi-sector coalition where they're able to come and voice concerns in the neighborhoods, to give suggestions on some things that they would like to see happen in the neighborhood. It's volunteer opportunities for community members to just come and be a part of what will be a positive change in Buncombe County, which, and I say it again, it is much needed. It's overdue. People need to be safe.
Yeah.
And so I know you had mentioned about the community-based organization. So is this kind of like a cohesion or some kind of collaborative to like an umbrella program over those various programs that's already in our community?
Yes, it's a cohesion. There's a lot of organizations that are coming together to work under this model. And a lot of it is already community-based organizations that are already in the communities that are doing the work. And what this model will do is just to help enhance some of the things that they're already doing, to give them different resources that they may not have been available to those organizations before. But also, I spoke about the grant. It enables these community-based organizations to actually hire people that are going to be there on a full-time basis and not, you see them, here, there. They're there on a consistent basis to where people can develop those relationships with these organizations because they're present all the time.
So what is the time frame for this program? Like, what are we looking at?
Well, the grant is for 3 years. So we will start implementation within communities sometime during the summer. And hopefully it goes beyond that, the 3 years. So
are we talking about 23, 24, 24, 25, 25, 26?
25, up to 25.
Okay. So what are some events you've done so far?
So as this collective, we haven't done any events just of yet, but we have partnered with the Asheville Dream Center, with the Mothers Group, Love, which is a life over violence every day, and a few of the mothers that have lost sons to gun violence. We did a community event in Hillcrest back in March, and then this past Saturday we did a Mother's Day Solidarity Walk. I think it was over 300 people that showed up to that event this weekend.
Wow.
But the mothers in that group are absolutely awesome. I know it was Miss Shivers came, who lost her son over in Buncombe Heights last summer. Wendy Brooks lost her son last year in April, and Miss Teresa Mosley was not able to attend this particular event because she was attending Barton College graduation because they gave her son an honorary bachelor's degree because he would have been a senior graduating this year. So those are some of the things that we have done so far. But as we go towards the implementation mode, we look to see a lot of events that are coming up. I will tell you about a couple other events that we do have coming up. Buncombe County is partnered with NC Safe, which is around a campaign around properly storing firearms, because June is National Gun Violence Awareness Month. So we encourage everybody to wear orange during the month of June. The courthouse will be lit up in orange. On June 4th, at the Eddington Center, will be a event, a gun violence event. And then I think on the 8th, if I'm not mistaken, we'll have another event that's coming up that partners us with Health and Human Services as well as NC Safe, and it's around infant fatality.
Yeah. So you said wear orange for the month of June. And that always makes me think of like when you go hunting and you wear orange. So
Exactly.
that has anything correlation with that?
So actually that's how they came up with the color.
Okay.
Because when you wear orange, it means that you're warning other hunters in the area that I'm in the area and you should be safe because you have on this bright orange vest.
Yeah.
So
I used to go hunting as a kid. I know the bright orange vest, and I was just like, well, how can anybody mistake me for a deer? I'm walking on all two, too late. I have a gun. I'm not sure what kind of deer we got in Mississippi, but the ones that we're taking home, they don't have armor fatigue. But different story. So yes, the orange is very important, and I think it's so important that we have these conversations about gun safety because the thing is, no, guns are never going away unless like magically. But if you're going to have a gun, be responsible because we know how many kids see them and they're like, oh my goodness, it's a toy. I can play with it, and it's not a toy. And say, well, let me check with Mr. Randy and see how much time we got. How much time do we have? Oh, he said we need to wrap it up. That's what that is. Okay. So, will we do this every time? What is something that you want to leave with our audience that you want them to remember?
I would want them to remember that I'm in a role with the county.
Mm-hmm.
And the county truly does care.
Mm-hmm.
They have heard what's going on in the communities, and they are springing into action. That we understand that we didn't get here overnight and that we're not going to get out of it overnight, but we are here and we will be present to move forward. And the hope is to see change and safety for all communities within our county.
Mm-hmm.
And I'd just like to encourage the listeners out there that, violence is something that we do want to see tick down, especially in our neighborhood and especially around gun violence. So those who are interested, I strongly encourage you to keep an eye out for Mr. Will Baxter out in the community as the Community Safety and Violence Prevention Coordinator, which is housed in our Justice Services Department. And you can find more information always on the Buncombe County's website at buncombecounty.org.
And that was Professor Jones, if you didn't recognize that. And as always, I like to wrap this up with just saying that, so often we look at ourselves and we try to remove ourselves from what is going on in our community. But our community makes up everyone. And it just say the community is a huge house. And if the left side of the house is experiencing some foundation weaknesses, eventually it's going to start occurring in the right side of the house. So therefore, it is always best to be involved, look around, see how you can help, see how you can listen. Sometimes the best thing you can do is be an ear and a shoulder. Sometimes the best thing to do is to be the person that answers the phone calls for organization. There are so many ways that we can give back to help get the foundation to match all sides of that house. Now, are we saying it's going to be perfect? Of course not. If you've ever broken a bone, you know that in that 6 weeks as it repairs, we didn't say that it goes back to normal, it repairs. And repairs always mean there's something that happened that needs to be repaired. Yes, it's going to be different, but you will still be able to use it. As we repair our communities, yes, they're going to be different. Yes, there will be some problems here and there because it is repairing, but it is still going to be usable. And that's why we got to understand that our folks are not thrown away. They are still good people. They are still wonderful folks. And we at Buncombe County, we know that. And that is why we are pouring into our communities. That's why we're caring about our communities and we're creating these programs because we're listening and we want a better future. I often say that Buncombe County is so small that we could write the blueprint that could change the world. And I truly believe that because we are one Buncombe. And to all of you out there listening, give back any way that you can. Look around, see if there's something that you want to do, and get in contact with us because we're always here because we are one Buncombe. Until next time, this is Zakia.
Thank you for listening to Tapped In, Buncombe County's half hour to empower, here on WRES 100.7 FM in Asheville. Learn more about today's topics at buncombecounty.org. Otherwise, stay tuned for more great episodes coming up.